so what we found is starting on the clinical side, making sure the clinical teams are all aligned, and then having them take us to the hospital leadership has been the most effective path for us.
And like, how do you decide what hospital? I kind of asked you this before, but how do you decide what hospital to go to?
Just based on need.
Okay.
We're looking for folks who have a hair and fire problem, have no other solution, and are in desperate need of access to diagnostic ultrasound. And so those are the critical access hospitals in the United States. So that's who we're initially focused on.
So change it up a little bit. So what's something you've done in the past that you're proud of, but it's not public knowledge, right? It's not on your resume, not on your LinkedIn.
Yeah.
Like, of course, your wife knows about it, your parents, close friends, but like even people on your Doppel team don't know about it, right? Something like you're really proud of that you've done in the past.
Yeah. I'm gonna take us back to high school. So shout out to Andy Pollins, one of my best friends growing up. He got me into like peer-to-peer downloading, and so I would download like bootleg PlayStation 2 games and burn them onto CD, and then I would go to my school and get people to give me their PlayStation 2s, and I would open up their PlayStation 2 and then solder a clothespin to it so you could unlock the CD tray, and then so what you would do, and then I would close it back up and give them the PlayStation 2 back. And so what you would do is you would put a Game Shark in, you would start the PlayStation 2, and then when the Game Shark reached a certain screen, you would unlock, using the pin, unlock the PlayStation tray. And so the PlayStation didn't know it was actually unlocked. It thought the game was still running. You take the Game Shark out, you would put in the copy game, and then you would close it up, and then your copy game would start playing. And so I was always really proud of that because it showed me that you can create a new market by giving someone this tool, and then they need to come to you to buy like the copy games. And so that's a way of like cornering a market. And so I was always proud of that. Even though
you're like, this entrepreneur stuff might actually work for me.
right, exactly.
Yeah. So there's a lot of stats out there. Like one stat in front of me, like globally, 5 billion people like access to care. There's all these stats out there. But like, how reliable are all these stats? Like, what are these like stats can be like made for both sides, right? Like, how do people know these stats are reliable, and where do these stats come from?
Yeah, I think it's challenging when you get into giant numbers like that. To like really know the specific details. When I look at stats like that, I'm just thinking like there are an incredible number of people who don't have access to care, whether it's 5 billion or like there are billions of people who don't have access to care. We can be confident in that. And then I think you got to do your own research. Like we went out to different countries. So for example, we talked to hospitals in Kenya and Tanzania where the access to specialist problem is like 10 to 100 times worse than it is in the US. Reimbursement is similarly 10 to 100 times lower than it is in the US. And so just the challenges in that environment are completely different, which for me just illustrates why there are a lot of folks who don't have the same level of access that we do.
Is healthcare, or should healthcare be like a basic human right?
Oh yeah, absolutely. I think so.
Why?
Because it dictates our opportunity to not only life, but to do everything else. If you can't get out of bed in the morning, then because you're sick, like that prevents you from living a complete life. And I think everyone should have access to the healthcare that they need. I think everyone deserves that. And the way that we're trying to achieve that is by making healthcare low cost and distributed to everyone, so that just by default you have it.
Is there like a specific medical situation or certain specific patient care problem that like inspired this Doppel to start?
Yeah, I mean, for me, it was my grandfather. Um, he he had cancer, and this is while I was at Microsoft, so around 2011, 2012. Um, and I remember going to his doctor's visits and looking at his medical images. He had pancreatic cancer, and I remember looking at his medical images, just like, I have no idea. I have no idea what I'm looking at. I have no idea how I can help. Um, and so I felt helpless. Um, and shortly after he passed away, that just was a trigger in me. Just like, I can't keep working the job that I'm at because I'm not helping anybody. But I have all this knowledge, and I feel like I can apply it to make a difference. And so that was the catalyst for me.
So how is Doppel like measuring success beyond revenue? Is there certain KPIs you're tracking or certain impact metrics that matter most to y'all?
Yeah, a couple of them are, to date we've scanned almost 1,500 patients in rural areas. We've decreased wait times by from 6 months down to about a week in some cases, and so really having an impact on people accessing the care that they need a lot faster. Those are the metrics I'm most proud of right now.
And you had like one person dedicated on your team to track all this stuff for you, or you rely on like hospital stats?
Both.
Okay.
But we've got a person on our team that's tracking all this.
And let's talk about your co-founders. How many co-founders are on the team?
Excuse me, two co-founders.
And like, did y'all like lifelong friends? Like, talk about how the relationship started. Because you know the thing, co-founders are more important than your marriage, longer than your marriage. You know, for like, if you don't have co-founders, you fail. But if you have co-founders, you fail, right? So talk about that process, please.
Yeah. Shout out to Steve and Wayne, Dr. Sessler, Dr. Monsky. I mean, it all started around technology. We're all a bunch of nerds who love tech and love helping people. And so I remember the first time I met Steve. It was actually at CoMotion on the University of Washington's campus, and he came in and we just started talking about the procedures that he performs every day and the things that he wanted to do to improve access and distribute his skill set to people who are further away, the things I wanted to do to use technologies to enable that. And these are his words, not mine, but I share them, which is like, it was like love at first sight. It was like, we've got to work together to figure something out. And then he's just an incredible person that challenges me, but also is you know what I mean, like is willing to see flaws, but also help you enhance strengths. Just like someone in a marriage, and Wayne's the same way. And so couldn't say better things about my co-founders and the folks I get to work with every day.
So don't tell the details, but talk about the process, like how, like the equity part. How do you decide who got what part of equity, and like how do you decide like you would be the best CEO?
I would say through trial and error is the high level way to look at that. We just started working together and just naturally fell into roles that worked for us. And then when it came to equity, we just had honest, open discussions about what we were looking for, what we thought we could contribute, and how that equaled an equity amount. And then we all just settled on things we were happy with. My personal goal was to decide on numbers and never think about them again. And we've been pretty successful in that department.
And was this like a 2-month process, 2-day process?
I mean, we had been working together for like 5 years before we started Doppel. And so hard to say specifically, but I think when we started talking about equity, it probably took a few months to just hash things out.
Yeah, I think the biggest advice there, a lot of these founders like, they decide like one day, right? You got to take some time and like process. You got to, you like think through it, right?
Yeah. That worked well for us, taking the time to think through it.
So right now, what do you think are the biggest gaps in healthcare that tech is not solving yet? What should tech be solving that they're not solving right now?
I mean, I'm obviously biased in thinking this because this is why we started Doppel, but just access.